Now coming to the second part, imaging modality, imaging of the congenital heart disease. This is ever winding in case of pediatric heart disease because the heart is a dynamic structure and lot of malformation will happen, and it has to be imaged particularly in patients with congenital heart disease. Here the first and foremost is the CT imaging, cardiac magnetic resonance imaging. It is called as cardiac MRI, nuclear medicine scan, interventional radiology procedure where you image the heart in the cath lab, gastrointestinal procedure like a barium meal or some procedures which involves the gastrointestinal tract, and not to forget the gold standard of heart imaging, which is echocardiogram. And coming to the essentials of the imaging modality, here you should understand the knowledge of the environment including magnetic field. For example, the child is coming for MRI. You should have a thorough knowledge about the imaging modality including the magnetic field and what happens if there is magnetic interference with your anesthetic machines or some mechanical devices. And always resuscitative card should be available in the area where imaging modality is being done. And most important thing is, if some untoward event happen, you should be able to get the help as immediately as possible. To summarize the imaging modality, this is used for diagnosis of congenital heart disease, to understand the mechanism and physiology behind it, and also to know the severity of the disease. Most importantly, the monitoring, what monitoring you need for perioperative period, risk satisfy the child before the child undergoes any procedure, and procedural planning. For this, all imaging modality is required in the preoperative period. Well, first and foremost, as I said earlier, echocardiography is important for diagnosis. Nowadays, cardiac magnet resonance imaging, that is called as cardiac MRI. Now it has come in a big way and gives more precise diagnosis than echocardiogram with relate to volume, function and shunt, everything. MRI can give a better picture than echocardiogram. Nuclear cardiology and cardiac CT. This cardiac computer tomography will come in handy, particularly when the posterior structures are involved or vascular structures are involved.